this computer that works. All right, so we're recording. Okay. So welcome everyone to my channel. I'm Dr. Glass. This is the Transformational Moment. And this week we have a very special edition because this is Black Maternal Health Week. So we are going to start off with an amazing just wealth of knowledge of a person in the person of Dr. Reba Williams-White. She is, first of all, a child of God. She also has more than 35 years of experience in the medical industry as an obstetrician gynecologist. She completed her OB residency at St. Joseph Hospital down in Houston, Texas. And upon completion, she opened her first office in downtown Houston and then later moved to Terrell, Texas. She's been blessed to open WW Women's Health Inc. in Terrell in June of 2002. And she was further blessed to open her second office in Rockwall, Texas in January of 2012. On May 31st, 2018, she closed her doors to private practice permanently and semi-retired. Now, with all this experience, I don't know why she wanted to semi-retire on us, but she did. Let's see, but on March 1st, 2020, she permanently took down her shingle, thus fully retiring. She's become a freedom fighter. God is allowing her to change the lives of so many families across the country. And God has allowed her to help people with their health for over 35 years. And so now he's allowing her to help people with their wealth. Her life exemplifies how Christ can guide one to achieve great things, and that she most certainly has. This great lady holds her commitment to God, her family, her dedication to academic excellence and Christian education in high esteem. Dr. Reba credits her late mother, Sister Josephine R. Davidson, for her value system. Her favorite scripture is Philippians 4:13. I can do all things through Christ who strengthens me. Ladies and gentlemen, I present to you all Dr. Reba Williams-White, OB-GYN, now freedom fighter. Miss I'm Every Woman, and she makes my life so amazing too. Dr. Reba Williams-White, welcome, welcome, welcome to the Transformational Moment.
Well, thank you, thank you, thank you. I am glad to be here. And I just looked down at my screen and I don't know who I jumped in on, but that is not my name. So if you'll give me the opportunity to rename myself, because that name up there, now Dr. Reba is in the house. I love the hashtag Ask Dr. Reba. But thank you so much for allowing me to come and have a few words, because I tell you what, you standing on my shoulders, because you as a student had goals of being a physician, and look at God, how he has blessed you. So yes, thank you so much for what you're doing for the females that are involved in your practice, and especially the ones that are pregnant. Thank you for what you're doing. Yes.
Thank you, thank you, thank you. Let's see, let's jump off into it, okay? So first thing I kind of want to do, for most people, especially for women who are starting to transition to the age of, it's time for me to go see the OB-GYN. What are 5 questions that a woman should ask when she's selecting or trying to determine which OB-GYN will be best for her and her needs?
Well, the number one question is, a lot of time people find OB-GYN doctors that are referred to them by a family member, by a friend, by a cousin, by a church member. So when they get referred, you know, they're already excited. But when they go and meet that person, because everybody is not a good fit with everybody. And so don't be upset if you don't fit with that particular doctor, because some doctors are always in a hurry and you may feel like they don't care about what's going on with you. But when you go in and look for a doctor, you want to check and make sure, number one, they are knowledgeable. Number 2, they have a pretty good bedside manner. I mean, sometimes we get real busy, but for a real good bedside manner, because that shows some compassion and taking some time, and that they'll be able to address your concerns. Because sometimes doctors move so fast, you wonder, when I have an emergency, are they going to just blow me off? Are they going to be moving fast? So that's one thing to always think about. Other thing is, you know, what is their experience? How long have they been out in practice? You know, I feel comfortable in referring to even the younger docs, because if you've gone through med school and you've gone through residency and you took time to hang up your shingle, then somebody's got to give you a chance. Somebody's got to come on through your doors. So I want people to keep their mind open, even if someone said, I just finished my residency last year or 2 years ago, because sometimes you go to somebody been out there for 30 years, sometimes they get set in their ways, and then, oh Lord, I'm not going to say much about that. So you got to make sure your chemistries, but then also you want to make sure that they have a good, pretty good office staff, because sometimes you can have a real good physician, but the people that answer the phone and the people that are working with the doctor can literally be a demise of a practice. And so I always tell people, if they find that sometimes a doctor is not aware sometimes of things that's happened, but sometimes they know, but it's always good to go ahead and bring it to a doctor's attention before you fire them because so-and-so answered the phone and made you mad, whereas you had a good rapport with your doc. So sometimes things like that will keep patients from going back to a doctor after they've already done the interview and got a doctor, but little things with office staff. So physicians have got to make sure their office staffs are always, I tell my girls, when you answer that phone, have a smile on your face.
That's right.
They can tell when you say WW Women's Health Center or WW Women's Health Center, how may I help you? So, you know, I'm real critical about people and things. And so those are some of the things that stand out in my mind.
I love it. Excellent, excellent points, especially on that office staff. Because I know when I was opening my clinic, front office is the first introduction for any person coming into your clinic. Absolutely. And then front office is like, hi. What is that? No, we're happy. We're elated. We're about health. Your health is your wealth. We want you to be excited. So that is a huge point of a contingent, honestly, for a lot of people just looking out or looking for the right doctor. So I love that. And I love the knowledgeable too, because that is super important when you're asking different questions. And when your patients know that you're knowledgeable, it makes them more comfortable to ask you anything. And sometimes patients withhold super important information that we didn't know they were holding on to. But once they feel comfortable enough and say, oh no, she knows what she's talking about, or he knows what he's talking about, then they're like, oh, okay, but what about this and that? Da, 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 da. So you're like, yeah, good stuff.
I agree.
I like it. Let me see my next question. At what age is a woman classified as advanced maternal age? And what are specific concerns for first-time expectant mothers of advanced maternal age?
Well, advanced maternal age basically is a woman who is 35 years or older. And
what if she lies and says she's 25?
Well, you gonna see her birth certificate. I mean, you know, that's one thing about when you going to see your doctor, you got to tell the whole truth, nothing but the truth, so help you God, because otherwise, how in the world are we going to help you? I mean, that's sometimes they play them little games, but then when the tongue in the mouth don't line up with the tongue in the shoe, it's like, wait a minute, there's something going on there.
That's right.
But when they're 35 and older, it puts them at a risk for some chromosomal abnormalities, specifically, you know, the trisomy, where the kids could have potentially some mild or some severe forms of mental retardation. Those are the main concerns with advanced maternal age. And I know I had my last son at the age of 36, and I could not wait to get an amniocentesis to make sure things were going to be okay. But you know, so there are some people that say, I don't want an amnio, but I have two schools of thoughts on that. One school of thought is if they get an amnio and they know that they're going to have a special needs child, that gives them time to prepare. Mm-hmm. It's a little bit sad, kind of. Yeah, it was kind of concerning when patients have not had any kind of advancement testing. And then when they have a baby that's born, that they find out that it's going to have some challenges. I mean, after having a baby, you're already going to cry your heart out anyway. Right. I mean, it gets in that depression. So my thought is those that are concerned, get that test done if it's offered to you, and then you're preparing for it. But then you have some that says, well, I don't want to know because there's nothing I'm going to do. Well, I think that you should be able to prepare for it. So those are my comments on the chromosomal abnormalities.
I like that. Let me jump back to the test that you just stated, amniocentesis. For those who don't know, can you kind of explain what that test is and how it's done?
Yeah, and amniocentesis is where they actually take a needle and sterilize the abdomen and with ultrasound directed guidance, and they're able to go in and get fluid from around the baby. Now they have to be very careful because sometimes the placenta is all on the top of where you're trying to put your needle through. So a lot of times you do not want to be putting your needle through there because you can get blood into the amniotic fluid, and so it'll give you a false test. But for the most part, most of the guys who do the amniocentesis, they look for an area where there's no baby parts in the way, no umbilical cord in the way, and no placenta in the way, and then they draw the fluid, send that to the lab, and they do chromosome studies. It usually takes about 14 to 21 days to get those results back. And you can actually get the actual chromosomes. Now they have another test that's called the NIPT test, that is done early in pregnancy, which is a non-invasive prenatal testing. And so many of the patients want that test. Now, doc, they want that test not to know if their baby has chromosomal abnormalities, not to know if there's something wrong. They want to know.
Is it boy or girl?
They want to know.
That's it.
And it's okay if they want to know, but my thing is, does the baby have everything that it needs?
That's
because sometimes the chromosomes can be abnormal, and you have a normal baby, but sometimes they're not. And so, but it's the way society is now.
Yeah.
At 12 weeks, people are able to get an idea what they're having.
That's true. And I know, especially for all my friends that have been having babies. Oh, well, do you know what you're having? Oh, girl, yeah, I found out when I was 9 weeks. You did? Oh, okay. Well, just put that down as a question mark, just in case something hadn't come through yet.
Yes.
I love it. I love it. Oh, one more question up on the realm with the testing. For women who don't have insurance, they may be on Medicaid. Is amniocentesis a test that Medicaid will cover?
Medicaid will cover any test that a doctor feels like it's necessary. Now, amniocentesis, that's a covered charge. That's a covered charge. Now, when they don't have insurance, then that's going to be out of pocket charge that I'm sure the provider would be able to let the patient know what that cost would be, because you have to remember the testing is the part that's going to be the charge, not sticking the needle in and getting the fluid. It's actually running the test.
Gotcha. Okay. Great answers. Great. Dr. Reba, you're so knowledgeable. I love it. I love it.
Well, thank you.
Let's see. In regards to your patients that you treated that had chiropractic care during their pregnancy, what differences did you notice or were you told about when it came to their delivery, or even how they were feeling during their checkups, things like that?
Well, I didn't have a lot of patients that actually told me that they were receiving chiropractic care, but the ones that were, they were more mobile. They had less of what they call discomforts of pregnancy. You don't have discomforts of pregnancy, but a lot of them had less of that. And then they had a little bit more mobility when it came time for delivery, because when it's come time for delivery, a lot of people, even though they're getting that epidural, they want to go natural as possible. So it allows them to be in different positions for delivery or while laboring when they've had some mobility and been seeing their chiropractor. That's what I've noticed.
Awesome. So with that in mind, would you recommend chiropractic care to anyone pregnant?
Oh, absolutely. I sure would, because, a lot of pregnant patients, well, almost every pregnant patient as it goes along will have some low back pain. And that's basically from the baby causing them to push so far forward and put so much on the lower back, and they're going to have discomfort. So anytime they can go and get that stretched out and moved around so they can keep on moving and make it those 40 weeks of pregnancy, that's it. Awesome.
I love it. Let's see, for women who are desiring to become pregnant, what are 4 things that she should do to prepare herself for pregnancy?
Well, I'll give you 4. I'll give you 4, but you know
If you got
what?
10, we'll take those too.
You know what? Those that are trying to get pregnant, that's a blessing. Then you got all those ones who just come up pregnant.
Yeah,
Okay,
yeah, seen
we
those
don't
too.
get along. So those that are trying to get pregnant, number one, you know, when they're getting ready to get pregnant, their health. We got to look at their health, you know, because you have you have patients that are diabetic. You have patients that have high blood pressure. You have patients that have sickle cell anemia. You have patients that have all kind of diseases. And so we want to make sure that their blood sugar, if they're diabetic, that their blood sugar is in optimal control. If they're hypertensive, make sure their blood pressure is in optimal control. You know, whatever condition that they have, you want to make sure that that is in optimal control because there could be complications down the line. Number 2, the nutritional factor. You know, when patients become pregnant, we don't like for them to gain no more than about 15, 20 pounds. Okay. So if someone is already a certain weight, they're not going to be able to gain as much weight when they're pregnant because it's not going to be healthy. We only want them to gain an amount that's going to be healthy. Then you have some of those who are very, very small. Maybe I wouldn't call them undernourished, but don't really have maybe a good diet. So we want to do some nutritional counseling to them also to make sure that they have, you know, good nutritional support because nutrition is everything.
Yes,
everything. That baby only gets what you take in. And when you have people that say, I eat chips and drink a Dr. Pepper, and I might eat a sandwich.
Yeah.
Not good nutrition. So we're able to talk to those people before they get pregnant saying, okay, there are certain things that we want you to do. And then the other thing is we always want to test them for any kind of infection before they get pregnant because, you know, certain infections can cross through the placenta and certain infections can affect the baby. The other thing is any medicines that they are on, especially in hypertension, we may have to tweak and change some of those medicines because some medicines are not in the category B for pregnancy. Some are more teratogenic, which means if taken while pregnant could cause some congenital effects on the baby, some developmental effects. So, you know, if someone could do pre-pregnancy counseling, man, that's ideal. But 90% of people don't.
I believe it. I believe it.
They just come up pregnant because see, I think that some people don't think that they can get pregnant.
That is I've heard many patients come in and tell me that. And especially when I have female patients coming off of IUD, one girl was like, oh my gosh, I took it out and we took a trip. And the next thing I know, I'm pregnant. I said, yeah, that's what happens. You lost your contraception. She's like, yeah, but I didn't think it was going to happen like that. Or I had some, man, I've been with this one and that one. I'll be like, that's not safe, but we'll get to that later. And they were like, I never came up pregnant, but as soon as I got married, I got pregnant. Yeah, it happens. Yeah, it happens.
Yes, exactly. Yes.
It happens.
Or they'll tell you this story. It was a rainy night and the thunder was going and it was raining. And then I found out I was pregnant like 3 weeks later after that rainy night.
Yeah, it happens like that. I love it. I love it.
Now, 2 other things that I like to make sure that people understand when they're pregnant. Finances and a support system. You know, a lot of people, especially in the past year, their financial situation may not be the best, but when they let the doctor know or at least reach out, then we can be able to make some recommendations to them in terms of, you know, applying for other benefits, some things, you know, because they're going to need it. But then for a support system, on single moms that are pregnant, I tell you what, they have more baby daddy drama than anything. So, you know, the baby daddy may not be your total support, but I want everyone who becomes pregnant to make sure they have at least one somebody.
That's right.
That is a support system, because everybody gets mad at everybody when they're pregnant because of the hormones.
That's
and
right.
The baby daddy, whether it's a significant other or the husband, whoever it is, they get the blunt of what's happening because of
That's
the
right.
hormones. So you got to have a support system. And if your finances aren't right, you're going to be stressed the whole pregnancy. So, we got to have all those conversations up front.
I like it. Excellent points. Excellent, excellent points. Let's see, Dr. Reba, this is my last question. What is your favorite thing about being an OB-GYN?
Oh my goodness. My favorite thing is delivering a baby and hearing and watching that baby just scream and holler. And sometimes I scream and holler right there with that baby. Our big baby. We hollering, we thanking God, we thanking God. Yes, yes. That's my best part. I will praise God right when that baby's hollering, because that's what that baby's doing. That baby's praising God.
That's right. I love it.
Move, arms can move, legs can move, been cramped up in there for who knows. So that's my favorite part.
I love it.
Yeah, God bless these hands, and He has allowed me for 35 years to deliver over 6,500 babies, and these hands are blessed, and I'm so thankful.
That is so awesome. I love it, love it, love it. Well, Dr. Reba, that comes to the end of our wonderful conversation today. I am so appreciative. You have taught me so much, even in this short amount of time. Thank you, thank you, thank you. Do you have any final comments or anything you'd like to let our viewers know about pregnancy, good maternal health things, anything like that?
Well, you know what? First of all, Doc, thanks for inviting me to come and have a few words to say about, maternal health, because that's my passion. But one thing that I would like to advise people to do is to embrace self-care. When you embrace self-care and take care of yourself, making sure you're eating right, making sure you're drinking your water, making sure you're exercising, even if you're just walking 2 or 3 times a day, making sure you're getting your sleep, making sure that you are taking care of yourself. Because if like on the airplane, when you're on the airplane, they tell you if this plane goes down, there's an oxygen mask that's going to come down. Now, you have to put the oxygen mask on you first before you help anybody else. So that's my message to women. Put your oxygen mask on, take care of you, and then you're going to be a better you as you take care of children and significant others in your life. Back to you.
I love it, love it, love it. Thank you again, Dr. Reba. Guys, again, this is the transformational moment where we talk about the snap, crackle, and pop of chiropractic, being an entrepreneur during a pandemic, and just talk about women's health care and wellness. So if you guys have any questions, you can always feel free to call us at Glass Health and Wellness, 469-865-6135. You can send us a message on Instagram. We're at Glass Health and Wellness. Find us on Facebook, Glass Health and Wellness. So just give us a call if you'd like to make an appointment or if you have any questions for us. Thank you so much for tuning in. And Dr. Reba, thank you so much. It was a pleasure to have you, and we'll talk to y'all soon. Bye-bye.